Hello and welcome everyone to the BRITE Futures Initiative Secondhand Smoke Summit Kickoff Summer Extravaganza. Kickoff to the Summer Extravaganza. My name is Mitch and I will be your host for this evening. We've got some really wonderful stuff coming up for you. It's going to be an evening filled with learning, fun, prizes, and some information on summer opportunities. Today's summit will feature special presentations from Isabel Gomez from Ventura County Public Health and BRITE's very own, BRITE Futures Initiative's very own Estrella Torres. You'll also get an exclusive look at BRITE's upcoming summer opportunities. We have really cool stuff coming up for you this summer. And in this presentation today, there will be interactive activities and a chance for you to win prizes. Yes, there will be prizes for you to participate today. So make sure you stick around until the very end and you just might win. And I will explain what those prizes are a little bit later, but we do have some cool stuff coming up for you. First up in our presentation, I'd like to, and I'm very excited to, introduce and welcome Isabel Gomez. Isabel is the program coordinator for the Tobacco Education Prevention Program. She has been a health educator for over 20 years, covering a wide range of public health topics, from nutrition to immunizations. For the past 6 years, she has focused on tobacco prevention and education, working closely with cities, retailers, and young people to create a healthier and more tobacco-free environment. Please join me in welcoming Isabella Gomez. Woo!
Thank you. I'm so excited to be here. And I'm going to give you some information in regards to what the tobacco education program is, what we do, where we come from, which is Ventura County Public Health, just so you get an idea of the different resources that are available to you and the work that's going on in your communities around you. So like Mitch said, my name is Isabel Gomez, and I have been working with tobacco education for a while now. My focus is on policy. So let me share a little bit about what we do. What is Ventura County Public Health and what do they do? So one of the things that we do is we help prevent the spread of disease and injuries. And that can include our emergency medical services program. That also includes our HIV/AIDS program. Another thing that we also do is we promote and encourage healthy living. And that could be through our women's, infant, and children's program, which is also known as WIC. It can be our home health, public health nurses that make home visits to share and help people in regards to living a healthier life. Other things that we do also includes responding to disasters and assisting communities in recovery. So when we've had major fires in our area, we've been there to help people access resources that they may need. And also during COVID, we were the ones who helped make sure that the community got the immunizations that they needed. And lastly, we also assure quality and accessibility of preventative and healthcare services. So what does that mean? That means that we want to make sure that people are able to access any kind of health services that they may need, whether it's accessing behavioral health and where to go, or if they need supplemental food, if they need anything that they may associate with health, making sure that they have the resources to get all of those things. We also have a coalition. It's called the VC-ASH, which is Ventura County Action on Smoking and Health. This coalition has been around since 1998, maybe before a lot of you guys. But this coalition was part of a master settlement agreement, which asked us that in order for us to receive funds from the master settlement agreement, we had to make sure that the voice of the community was present and able to tell us what exactly it is that they wanted to address in the community. Part of VC-ASH is also the policy portion, where we try to make policy and system changes in our community to make the healthy choice the easiest choice. And part of that means helping communities develop city ordinances and even county ordinances in regards to secondhand smoke. Here you see on this slide the different policies that exist across Ventura County. We have different symbols that represent different things. We have the 3 purple houses, which means multi-housing ordinances. That means that there are laws and rules that exist in these apartments and these multi-unit housings where secondhand smoke is limited and people don't have a lot of exposure to it, which is very important, especially in houses where we have multiple families living in the same place. We also have comprehensive secondhand smoke ordinances, which are represented by the little cigarette that's crossed out with the red circle and a slash. Those are ordinances and laws that kind of say, hey, you know, not just in multi-unit housing, not just indoors, do we want to have these rules against secondhand smoke, but we also want to include public spaces like parks, like shopping centers, common areas. So there are a couple of cities in our county that have these comprehensive ordinances or laws that exist. Just to name a couple, we have Camarillo, Oxnard, Ventura. Moore Park has a very comprehensive ordinance. We have Thousand Oaks and Ojai. All of our universities and colleges across Ventura County are smoke-free campuses, so that's a good thing, which is also part of the laws and the ordinances of these shared spaces to make sure that there's less exposure to secondhand smoke. So that's a good thing for our universities and our colleges to be smoke-free. And lastly, we have the tobacco retail licensing. What is that about? So tobacco retail licensing, or TRL, are some ordinances or laws that exist in certain cities where on top of paying a tobacco tax, on top of paying a license to the state, they also pay a fee, an annual fee to their city. And that allows for the city to receive funds so that there are people that can go out and make sure that these retailers are receiving the education that they need, which is where we kind of chime in as the Department of Health, and making sure that they're aware of all the laws that they need to keep their licenses. So there are a lot of things going on in the county to help reduce the exposure to secondhand smoke and access to these tobacco products. Lastly, I want to tell you about a little bit of the activities that are going on in our county right now. Currently, we have been working a lot in East County. We were working a little bit in Fillmore, but a couple of things fell through with some changes that happened in our administration, and the coalition or the task force that was out there had some other priorities that they wanted to address first, which is totally fine, which is why we're there to support them in whatever that they need. But one city where it's really taking off in regards to getting ordinances passed is in the city of Santa Paula. We started in 2019 with the city of Santa Paula and started making some changes, doing some cigarette butt and tobacco litter observances. They went to speak in front of city council, and then the pandemic hit. When the pandemic hit, all of that had to stop. And they stopped meeting, and we weren't able to advance because just like in the city of Fillmore, we had other priorities that we had to address. But then in 2024, that same group reached out to public health again and said, hey, where are we with this? What can we do? Can we continue moving forward? And we said, sure, how can we help? So they redid all of their observations. They went to speak to city council, and we're hoping that by the end of this year, the city of Santa Paula will have a secondhand smoke ordinance. Well, I'll keep you updated. Make sure that you guys are aware. And if you have any questions, you can always feel free to reach out to me, and I'll help you give you information how you can get involved, or just to see, hey, Isabel, can you give us a status update? What's going on in these two cities, and how can we help? I'm glad to share all that information. I know it was a lot to to take in, but feel free to reach out to me, any questions you may have.
Amazing. Thank you so much. Thank you so much to Isabel for being here. We are so glad to have you as a presenter and to have Ventura County Public Health as a collaborator in the things that we do. So once again, a big warm round of applause. If you're watching at home, clap in front of your screen here for Isabel. Next up, we are very excited to introduce one of our BRITE Future Initiative's team members, some that you watching in the audience may already know and have been interacting with, but I'd like to introduce Estrella Torres. Estrella is BRITE Youth's Development Specialist and a recent graduate from UCLA. She is a first-generation Latina and a proud daughter of Mexican immigrant parents. Born and raised in Oxnard, Estrella is passionate about serving underserved communities through advocacy, community organizing, policy work, and in the legal field. In her free time, she enjoys running, going to the gym, expressing her creativity through singing, dancing, and art. So we're going to get her presentation all set up for you in just a moment. All right, a warm welcome now for Estrella.
Hello everyone, I'm Estrella. Thank you so much, Mitch, for the introduction, and thank you to Isabel for that presentation she had from us from Ventura County Public Health. So this is just our lesson outline for the day. It's understanding secondhand smoke and smoke-free spaces, so kind of covering the basics, how that affects youth, how local government affects your community, and how that would affect these smoke-free laws, as well as some Ventura County smoke-free cities that Isabel also went over, some data we collected from Santa Paula and Fillmore students, a few advocacy building skills for you guys, so you guys could walk away with a few skills under your belt, and then at the end we're going to go over some action items we could do. So number one is, what is secondhand smoke? So secondhand smoke is simply breathing in the smoke from other people who are smoking around you. So you don't physically have to be the one smoking. You're breathing in the smoke that other people are actively smoking. This encompasses all kinds of smoke. It can encompass tobacco smoke, nicotine smoke, and cannabis products as well. And there's basically different types of smoke as well. Obviously, it could be from cigarettes, from tobacco, from the cannabis plant, but it can also be aerosol, which comes from vaping products, electronic cigarettes. I'm sure those have been probably the most popular we've seen at schools. All of those can have negative effects on your health. And just because it doesn't smell, that's a big misconception or myth that people have of specifically with vape products and aerosol, is that it doesn't smell as much as like a cigarette or a cannabis product, but that does not mean that it is safe. And then why secondhand smoke can be harmful. A few of the health risks, these are more like long-term. If you're constantly exposed to secondhand smoke, could be strokes, high blood pressure, asthma, heart disease and heart attacks, lung problems, and lung cancer. So all of these things can happen with prolonged exposure. This means that secondhand smoke is never safe, right? That's another misconception, is people think, well, I'm not smoking, it's safe for me. But that's a misconception. All secondhand smoke have the potential to harm your health. And then a few harmful chemicals that you guys may not know about that can appear in tobacco products and also vaping products. Benzene, which is found in gas. Butane, which is used in lighter fluid for like candles. Cadmium, which is used in batteries. Formaldehyde, which is used in fertilizer. Ammonia, which is used in cleaning products, as well as acetone. Everybody knows acetone, real nail polish remover, can also be found in these products. Rubidium, which is kind of like the color that you see when you see fireworks explode. And then ethylbenzene, which are found in paints and pesticides. So it's also important to note that some of these chemicals have also been known to cause cancer, specifically in like the tobacco products. And also, if you mix some of these chemicals, they can make potentially new chemicals that we may not even know about yet. So as I explained a little bit before, I'm going to go more in depth between the difference between smoke, regular smoke from like cigarettes, for example, and aerosol. So the smoke, obviously from cigarettes, it smells a little bit more, it's more obvious, and it's known to cause long-term cancer and long-term effects, versus aerosol is more of a lot of people think it's like water vapor coming out of vapes, but it's actually not water vapor. It's aerosol, which can be compared more to like a hairspray, a residue. It can get stuck on surfaces for a long time, on your clothes, and it's also harmful for your health, but because vape products have not been around for as long, I believe they've been around for 14 years versus cigarettes have been around 80 plus years, I believe so. We still don't know the long-term negative effects all of aerosol. So it's important to keep that in mind. We still need to do more research. There still could be more negative effects of that. And these stats right here pertain more to tobacco smoke, but even brief exposure to that tobacco smoke can cause serious health problems or be deadly, especially for kids, young adults, and children, which I'll go a little over why later. And then secondhand smoke, specifically tobacco, has caused 7,300 lung cancer deaths and also 34,000 heart disease deaths per year. So that's just a little information on the extremes on where this could go. And then here it is. I'm going to explain to you why secondhand smoke is so more riskier for youth. And this is simply because youth are still growing, they're still developing. The brain is technically not done developing between the ages of 21 to 25. So before that age, you're very much more vulnerable to it stunting your growth, which I'll talk a little bit about more. But based on this, I want to ask a discussion question and ask, do you guys think children and teens can always choose to be in spaces that are smoke-free, such as homes or public spaces? Can they always choose that? I want to know what you guys think.
So we'll be putting this in the chat, right? Or is this one meant to be?
In the chat.
This one be in chat, okay. All right, so I'm going to go through some of your answers from the chat here. I'm seeing not always. I'm seeing no. I'm seeing not always because parents and adults around may still smoke, even if the kids don't want them to. The parents might still be smokers or other family members. We have an answer that says it's not always easy to find a place where there's no smoke possible. A really great answer here is teens and youth do not always choose smoke-free areas because their decision can be influenced by their friends, other social pressures, surroundings, even if the young person prefers smoke-free environments because that would be healthier and more comfortable for them. Excellent. These are all really great answers. So we'll throw it back over to Estrella to continue her presentation. Thank you for everyone who participated.
Yes, thank you so much. Those answers were amazing. It's very true. Children or teens cannot always choose. At the end of the day, they are minors. They do have parents, and ultimately, in a lot of situations, it's the adult who has the last say, and unfortunately not them. A little bit more about ways that secondhand smoke can impact youth health. Is definitely throughout the body. So the first one would be damaged lung development because they're still growing. It can cause slow lung growth or even reduce lung function, so how your lung operates. You could have breathing problems. Also damaged brain development, which it's a really big one because this contributes to like cognitive problems. So you could start having problems with your memory, your concentration, your decision making. Also learning problems. So you might notice that you might be have lower IQ or academic performance lowers. Maybe you're getting worse grades because a youth has been exposed to secondhand smoke for a long period of time. It can also change your behavior. So things like aggression, you can be more impulsive, you can have more mood swings, and also become more irritable. And remember, again, this is simply just being exposed to secondhand smoke. You don't actually have to be smoking it. So like if a family member in your house, like you guys mentioned, that could definitely contribute to that. And as well as stunted physical growth. So it can physically stunt if you're still like a child, maybe between the ages of like toddler to like preteen. It can stop your height growth, as well as lower your weight or stop your weight growth as well. And then a little bit more on the health risks, obviously breathing problems. So this can include frequent coughing and sneezing or shortness of breath. Developing asthma, but also if you already have asthma, it can cause more frequent or severe asthma attacks, as well as damage to the eyes and teeth, ear infections, brain tumors, lung cancer, and SIDS, which is sudden infant death syndrome. So this has happened in some cases where a baby is exposed to a lot of secondhand smoke and they suddenly pass away. So that can also happen as well. A little bit more on how it can affect youth behavior. It's kind of like a trickle effect, right? So if it's pretty normal for a community or even a household for people to be smoking, this causes the normalization of smoking, right? So then young people might think it's okay to smoke, it's normal to smoke, there's nothing wrong with it. Then that increases the likelihood that they themselves smoke or they start experimenting with smoke because they're just surrounded by it. And then after that, because they start smoking, that also heightens the likelihood of them becoming addicted later on as youth, but also as adults. So it's definitely a trickle effect. And to get to the root of this problem, we have to figure out how do we denormalize, this behavior among youth? What's the best way we could get to the root of the problem so that all the trickle effects after that, we could prevent it? A little bit more about areas where secondhand smoke can show up in your community. This could literally be anywhere, but I categorize it as public areas. So like Isabel mentioned, this could be parks, beaches, or outdoor restaurants. Youth areas, it can even happen in schools. I know that it does happen in schools or near daycare. So even where youth are present, it could still be happening. One that a lot of people may not know about could be apartments or multi-unit housing. So this is just, a building with a bunch of apartments there, right? And it could be very common because although one family might not smoke in one apartment unit, maybe the family next to them, maybe they smoke. And this is what we call drifting smoke because that smoke can actually travel through doorways throughout the different apartments, through the air conditioning systems, or through cracks on the walls or even vents. So this is actually a major concern too in Ventura County for people living in apartment housing or multi-unit housing, especially for young people, but also elderly people, especially it affects them too. And that brings me to our next discussion question. So where do you think is the main place where youth are exposed to secondhand smoke? This could be from experience or maybe just what I mentioned right now, and feel free to put that in the chat and we'll collect your answers right now.
And a reminder for everyone, participating in the chat, participating in the activity makes you eligible for receiving some of our prizes here. And $20 gift card to Subway. So we've got some cool stuff in here that Kira showed off, but really nice and summary stuff that we're excited to hand off to you. Okay. Now, Estrella, could you remind us of our discussion question here?
Of course. So where do you guys think the main place where youth are exposed to secondhand smoke?
The main place. Okay, we have some answers coming in here. So one of our first answers is in their homes. In their homes, if they have parents or family members that smoke. Another answer is that it can be from public places that they're walking by. People smoking on the sidewalk or in alleys or in parks. A really great answer here is public areas that don't have restrictions on secondhand smoke or smoking. So if you're going somewhere that allows smoking, of course, there will be more exposure to secondhand smoke. Here's a really great answer. Secondhand smoke is most commonly exposed to youth in their homes or their cars where family members are smoking. And youth can be exposed in public places or social gathering that allow for smoking or vaping. Amazing. A lot of really great answers in here. It seems like you all are on the same track in their homes with family members or in public places where smoke and vape is allowed. Okay, thank you so much for your answers. that makes you eligible for our drawing later for the prizes. And I'm going to hand it back over to Estrella to continue the presentation.
Yes, thank you guys so much for answering. You guys are absolutely on the right track. It is definitely homes, mostly because youth cannot really escape their homes if their family members around them are smoking in the home, or like they said, in the car, or maybe there's other, especially people living in the apartments, like I mentioned last time, they can't escape other people smoking in apartments either. So these are just a few individual things that you guys can do to protect yourself from secondhand smoke as youth with the power that you do have. Simply just stay away from areas where you know a lot of people are smoking, right? This could be more like adult areas, maybe bars or adult restaurants. Visit areas where smoking is banned, which was actually what somebody said in the chat, so that's amazing. Yeah, just go to places where maybe there's no smoking signs, or you know that smoking is prohibited there, a youth area. And then lastly, kindly and respectfully ask people if they start smoking around you and you're not comfortable with that. It's completely fine to respectfully ask them to not smoke around you, whether it be in your personal room, your personal house. That's something you guys do have the power to do in a very respectful way. And of course, eliminating smoking is the only way to fully protect people from secondhand smoke, because obviously it's unavoidable if someone, like a stranger around you, is smoking, right? But what we could best do is try to reduce that and avoid it the best that we can as individuals. And then I also want to talk a little bit about substance use and how that relates to low-income areas, low-income communities, and how they're more vulnerable to this. So although people who smoke and are exposed to secondhand smoke has reduced overall in the U.S., inequality still exists, right? And this is because of historical patterns, not really the fault of the individual at all. This is mainly because there's a lot more tobacco retailers, cannabis, and vape retailers, and those are just stores that sell these products, right? There's a lot more of these stores historically in low-income communities, and also in neighborhoods with high populations with people of color, like the Hispanic community or the Black community. And therefore, a lot of low-income adults and youth are more likely to smoke or be exposed to secondhand smoke, and also just experiment with substances in general. So a few statistics here that I have is that 70% of smokers are from low-income communities. This shows like the historical unjust patterns, as well as low-income youth are twice as likely to be exposed to secondhand smoke. And 35 to 45% of youth in poverty, under the poverty line, also live with a smoker. And then I want to touch a little bit more on why this happens, because it is more a result of the environment that low-income communities grow up in and the system we grew up in, rather than individual fault. So, and historical unjust practices and uneven protections. As I mentioned, higher access, more stores in these communities contributes to that. If there's more stores, more people are going to buy those products. There's also more targeted marketing and advertising in these communities historically, as well as companies try their best to keep these products at very low prices so that low-income people can afford them. They actually spend a lot of money to ensure that these prices, specifically with tobacco, stay low as best as they can. So an example of this is like way back when people probably didn't know all the effects of tobacco and cigarettes. But in the past 60 years, tobacco companies handed out free cigarettes to low-income kids. They also gave tobacco coupons with food stamps. And food stamps are typically given to families who are struggling with getting food on their own. So that's just two ways that specifically low-income people were targeted by these companies. Also, in general, low-income communities lack resources, right? They don't have as much resources in prevention education, which we're trying to be better at today. This is why we're having the webinar today open to all Ventura County. They also may have less social support and less resources for quitting if they've already started smoking. Lastly, they may have less access to smoke-free spaces. So this kind of goes with the topic of like a lot of low-income families live like mostly in apartments because they're cheaper. But if you do live in apartments, you might have a higher chance of being exposed to other people smoking in those buildings and that drifting smoke that I talked about earlier. Cool, so now we see a really cool map graphic, and basically this is just a snapshot of part of Ventura County. We see Camarillo, we see Oxnard, we see Ventura, and we also see Santa Paula on the sides. The red dots pretty much indicate tobacco retailers, which are just tobacco stores, places that sell tobacco. The yellow squares are public schools, and then the green are just public parks. So I wanted to ask you guys now another discussion question based on what you're seeing. What cities do you think you see more of those red dots, the tobacco stores? Where do you see more of those red dots? Near schools, near parks? Are these maps surprising or not? What do you guys think? And I'll give you guys a second to think about that while we collect your answers.
So once again, take a look at this map. What do you see in this map? We'll put it back up on the screen. What do you see in this map here? Where in the county are we seeing red dots? What does this tell us? Right, we're getting some answers in here. We see that there are a lot of red dots. We're seeing a high frequency in that downtown Ventura zone in the avenue. We're seeing red dots downtown in Oxnard here. We're seeing a lot of tobacco retailers in a row. They all are following a big line condensed in these certain areas. We have people seeing that that they're actually near schools as well. Interestingly, to see that there are schools nearby these high concentrations.
Yes, awesome. Thank you guys for answering, and I'm going to move on to a little bit more of like the actual data we see from these maps. And actually we know that Oxnard and Santa Paula have a little bit more low-income communities happening there. We also see here from these stats that there's more tobacco retailers in those communities per 1,000 of the population, and there's also more retailers near 500 feet within schools, right? So in Oxnard, we see that in the pink, the 0.7 per 1,000 of the population, and then for retailers within 500 feet of school, there is 11. And this, this is also because Oxnard does have a higher population, but then we see in Santa Paula, we have even a higher retailers per 1,000 of the population, it's 1, and then we have 7 retailers within 500 feet of school, which is definitely significant because Santa Paula is much, much smaller than Oxnard, so the fact that those numbers are close or some are higher than Oxnard is important. And then on the other side, I kind of have communities that are not as low income, and as you can see, they have, less tobacco retailers in Thousand Oaks overall. But something I wanted to note is that Santa Paula is also smaller than Moore Park, yet it beats it in all 3 categories. So they have more tobacco retailers. In general, they have 31. They have more retailers per 1,000 of the population and more retailers within 500 feet of school. So that's definitely significant, and that tells us, like Isabel said, there's been a lot of work around this issue in Santa Paula, and definitely that it's needed, that you guys can even use your voices to make a change in this community if you're from this community. Cool, and then we're going to move on to a couple of local laws. Laws are just the official set of rules created by the government to keep people fair and organized and safe. This can be at the federal level, all of United States, the state level like California, or like we were talking about, the city level. And this is an ordinance, as Isabel explained. It's better to use an ordinance, which is just a local law, to address local situations, maybe respond to some urgent problems better. They could be a little bit more enforceable, so maybe have stricter rules. If we have a smoke-free law in a city, maybe we could put up more signs in that city, right, to enforce it a little bit better and make sure people aren't smoking in these spaces. A little bit more on smoke-free laws. It's basically just self-explanatory, ban smoking in certain places like public areas, indoor areas, housing, and schools. It's obviously for the health and well-being of the individual, but also for the community as a whole, to protect people, reduce that normalization, get at the root of the problem. And as we know, these are just a few cities in Ventura County that already have some smoke-free policies. They all vary differently, like it could be apartment housing, it could be public areas, but this is some cities that have already started doing that. And then just a few data we actually collected here at BRITE. We surveyed Santa Paula and Fillmore students, and we surveyed 84 students. Approximately 85% of students surveyed knew that secondhand smoke is not safe for the person not smoking. So most students know that secondhand smoke is a problem and that it could be harmful for their health. We also brought up the concept of third-hand smoke, and third-hand smoke is just typically smoke that settles on unwashed surfaces. It could settle on cabinets, on tables, on chairs. So we asked how long students think that this smoke can stay on those surfaces. And most of them, almost 65%, 65% said that it stayed on unwashed surfaces for days, weeks, and even months. And that is correct. It can stay on surfaces for that long if they go unwashed or unkept. I'm going to talk a little bit about social change, now getting into like how we can make change around this issue. We're shaped by our communities and our interactions. So in order to start change, we could do that through awareness, education, and advocacy. Specifically relating to secondhand smoke, you guys can educate youth in the community as well as support and advocate for smoke-free laws. Why local government matters. So local government is basically the smallest unit of government that directly affects your life. For you guys, this would be city council, right? If you're in Oxnard, Santa Paula, Ventura, where it's a group of adults that are in charge of making decisions in your city, like creating or passing laws. They are elected. This means people vote for them. People over the age of 18 who are eligible to vote for your city council members. Because they are voted by the public, city council has the responsibility to act on behalf of our concerns. So a way I like to remember this, especially for youth, is to remember the 3 R's of city council. So responsibility, represent, and respond. City council members have a responsibility to represent the people and respond to us and our concerns. This definitely matters for you guys because although you cannot vote yet, that's totally fine. You can definitely make your voice heard by connecting with city council on issues you care about. You do not have to be 18. And then a little bit more is building those skills, right? You guys might not know what civic engagement is or advocacy. Civic engagement is simply any action that helps your community make a better place. So a really good example would just be like maybe volunteering, helping pick up a park or clean up trash. Advocacy is a little bit different, but it's still considered civic engagement. It's more focusing on a specific cause or issue in order to make a change around it. So secondhand smoke can definitely be that cause. And then youth leaders or community leaders, decision makers, you guys might think, well, does my voice matter? And it does, because you guys definitely offer a different, fresh, new perspective that adults may not have to give to city council. You can build skills in leadership, research, public speaking, teamwork, communication, all of these things by engaging in advocacy and civic engagement. Now this is just a brief outline of how to advocate, like a little guide. Definitely we're going to get more in depth, but this is just a small guide. So identify a cause or issue. Let's use secondhand smoke. Learn the facts. So what you guys are doing right now, I'm teaching you facts. You guys are grasping this information. Why is secondhand smoke harmful? Then you can share your personal opinion or story. So a personal experience may be related to secondhand smoke, or why do you think it's an important issue? Then obviously connecting with others, you can then yourself go out and educate other people in your community, spread awareness, or connect with us like organizations like BRITE and BCPH. You can also speak to decision makers. So a lot of this would be maybe going to like a city council meeting and talking to them about this issue. And then campaigns are definitely more organized and strategic advocacy campaigns. So they're more organized, have more structure. And then the goal is basically to change public perception on an issue and take action on it and talk to other decision makers like city council members to see if they can help you make that change. So key elements of advocacy campaigns. If we use secondhand smoke, what does your campaign aim to achieve? So an example could be like reducing reducing maybe less people smoking in the community, or maybe increasing education. Your target audience, if you want it to be youth, maybe going to schools and providing that information. And also having a compelling message. Why is this important? Why is it like a pivotal issue in your community, and why would it help? Key elements would be methods, which I'm going to go over right now. A call to action, how can people join your cause? An evaluation, how is it effective? For example, did you get 20 people to participate? Did you get more resources in schools? So these are different methods which I want to talk about. Communication methods to educate the community and increase awareness on the issue. Obviously doing your own research and doing a presentation like this. Sharing resources to help people, maybe making posters or an infographic, going to a city council meeting, maybe doing like a community survey, surveying, questioning other people, putting on a community event, social media, right? A social media campaign, connecting with organizations, and getting even signatures from your community to get their support on a certain law or something like that that they want to support with you. And then some examples of youth advocacy and change. One of them was by our awesome youth advocate that you see here in the corner. She's a bright youth leader, and she spoke at the Santa Paula City Council meeting about the dangers of cannabis for young people. And as a result, cannabis businesses stayed out of the city. A lot of people came to speak, so that's just one example. Ventura Cannabis Regulations was prohibiting the on-site consumption of cannabis at retail stores, as well as tobacco-free advocacy, which I believe this is one done by an organization called One Step a la Vez, and they're advocating for less tobacco retailers near schools, as you guys saw. Cool, and now we're gonna move on to our activity. This is gonna be speaking to city council. So basically you're gonna pretend you're speaking at a city council meeting to support a smoke-free law. Right? All we ask is that you come up with one sentence you would say in your speech, and I put some guiding questions there for you guys to think about as you answer. Feel free to scan the QR code and provide your answers.
We're gonna do this one on Mentimeter here. You can stay up here with me. We'll do it together on Mentimeter. And if we can have one of our amazing producers, maybe Megan, put it in chat, or you can visit mentimeter.com and put in this code. Excellent. Looks like we already have a couple answers coming in. So we had an answer that said, I want to enjoy public spaces without worrying about breathing in harmful chemicals. Yes, me too. I would definitely agree with that.
Yes.
This is very relevant to what we were talking about earlier, is I want to keep my apartment building smoke-free. My pet's health is important to me, so I want a smoke-free building. Yes. Do you have pets at home?
I have 4 cats. So
4 cats.
Yeah, I think the smoking issue definitely does affect animals as well. Yeah.
Yes. What was it called? Is it smoke drift or?
Drifting smoke.
Drifting smoke. Yes.
Smoke.
Or third-hand smoke, where that stuff can get on, drift through the vents, through doorways.
Exactly.
Third hand can like go on surfaces.
Got some more responses. I support a smoke-free law because everyone in our community deserves to breathe clean air without worrying about the health risks of secondhand smoke.
That's a great answer. Another says, passing a smoke-free law will protect kids, families, and workers from harmful secondhand smoke and creates a healthier, safer community for everyone.
Awesome. I want to be able to have clean places such as parks where kids play smoke-free. We need to work together to protect our teens and families.
And another is, I don't want others to affect how the rest of my life will go without having any say. So that's so important. If you're talking to a policymaker, if you're talking to city council, you want them to know how important this is to you.
Nice. A healthy community is a happy one. I love that message.
I want to encourage the city to expand smoke-free public spaces to protect residents and children and teens from secondhand smoke.
And then the public should be able to walk in our city without moving across streets to avoid smoke. This should be a freedom everyone should have. Right. So if we put up maybe more of those signs or have more spaces banning smoking, we could definitely have more avoidance of that. Yes.
These would be really great to hear in City Council, and that is something that you can have as an opportunity to do as well with BRITE. And when we talk about some more of the opportunities that you can join us and maybe actually do some of these speeches. So we're going to jump back over to the presentation. I know there's a few still responding, but we do have to move on.
Thank you guys. We appreciate all your responses. So this is basically what you guys have been doing today. Call to action number 1, you guys attended this summit, so you have that step done. Number 2, we do have Youth Coalition meetings with workshops just like this every single month. If you're interested, feel free to email us. We also have it on our website for you to register and sign up for those meetings. The next one will be next month, since this is our event this month. And then some actionable next step opportunities for the summer. I want to shout out, we do have office hours, so anybody from the ages 12 to 26 can join our office hours to develop advocacy projects on whatever you want. On whatever you want. This could be on secondhand smoke, such as like what we talked about today, but it could also be on something else that you're interested in. We really encourage Simi Valley, Santa Paula, and Fillmore students to join our office hours, and you can schedule a time by emailing one of these emails that you see here. So yeah, if you guys are interested in that, we're always open, especially for summer. If you want something to do, feel free to contact us. And then we have an opportunity. It's going to be our graphic novel focus groups. So students can receive a $25 stipend for reading a graphic novel, which is like a comic book, and participating in a Zoom focus group discussion after you're done reading it, to talk to the other students about what you guys learned from the book. It's on mental health, so you guys will kind of do key takeaways. If you're interested, we do have a QR code here that you can scan and sign up, and we will contact you as soon as you fill out that QR code. And then we also have an opportunity specifically for Simi Valley youth. So if you're from Simi Valley, they are looking for a junior public surveyor to conduct surveys about the effects of tobacco products in their community. So requirements would just be, this is for middle and high school students, and you do have to participate in at least one Zoom training session and then one in-person session. So if this is something you're interested in, I would definitely apply. You could get the QR code right there, or contact us for more information at the email or on our website. We have all of this ready for you guys. Cool. Our last thing that we're working on actively is our improv summer classes. So youth ages 12 to 18 can join. This is a 2-week summer improv program. It's going to be at the Santa Paula Theater. You guys can build teamwork, creativity, leadership, communication skills, also public speaking through theater and improv activities. And we're also going to incorporate kind of like social change performance. So theater and learning the concepts of civic engagement and advocacy, and having different exercises for you guys. As of right now, these are the tentative dates that we have. It's going to be 2 sessions. So the first session is the week of June 29th through July 3rd. And then the second session is the week July 27th through July 31st. And they're going to be from 10 a.m. to 12 p.m. We will be providing snacks and lunch for free. So if you're interested, please come. We really hope to see you all there, and they're really fun. We've actually done a few of these, so I definitely recommend. And thank you so much. I appreciate your time.
Amazing. Big round of applause for Estrella. Woo! Thank you so much to both our presenters, for Isabel and Estrella, for the important information that they gave us. It was really wonderful to see, and really fun to see all of you in the chat participating. We're coming close to the end of our presentation here, but the moment you've all been waiting for is these prizes. So we did spin for everyone who participated. You had a chance to win, and we have our first winner for the gift basket here of the Summer Fun Kickoff. Our winner is Cushy. Woo! So we will contact you afterwards through email to make sure that you're able to get this, but congratulations. And we have our second winner, the winner for the $20 to Subway. Our winner for that gift card is Mia. Thank you for participating, Kushi and Mia. Congratulations. And if you didn't win, that's okay, because we'll have more of these and there'll be more opportunity to win gift cards and lots of cool opportunities with BRITE. Okay, thank you so much for joining us. We'll make sure to email everyone after. We'll send you the slides and some more information about the things that you learned today. And please reach out. Check us out on social media at BRITE Youth, on the website, briteyouth.org, and make sure you're signed up for the mailing list. That brings us to the end of our summit. So, woohoo! Thank you so much, everybody. I hope you have a wonderful summer and spend some of that summer with BRITE, and spend some of that summer, all of that summer, being healthy and making positive choices for yourself and for your community.